Okay, today I'm going to be doing a blood transfusion on a patient. So I would start out of the room by making sure I have my orders from the doctor that we need this blood transfusion and why we're administering it, along with the type and cross-match result, making sure that we've checked the blood. I will take this into the room as well to confidently ensure this with my patient. I also want to ensure that we have consent signed, as this is crucial for our patient to have done before we're giving this blood. So now I'm going to take these into the room. Hi, my name is Sophie. I'm a student nurse. I'm going to do two patient identifiers, name and date of birth, have the patient give them to me as well. And I'm going to close the curtain, door, whatever, for privacy during the entirety of the thing, going in and out. Next, I'm going to explain that why I'm here. I'm doing a blood transfusion. I'm going to ensure these pieces of information I have match with my patient, just have a confirmation, remind them of this consent that I have, and then have them confirm their blood type with me. So on here, I have that their blood type is a positive. And so I will double check that with the blood bank and make sure that we're administering the correct things. Other than that, I think we're good. So I'm just gonna set these here for now. I'm now going to assess your vital signs to ensure that you're doing okay, ask if they have any allergies, and make sure that everything's good. I'm not gonna do it for sake of time, but I would do heart rate, blood pressure, temperature, all those necessary things. I am going to listen to lung sounds though, as I feel this is a vital thing to check for fluid overload in the patient. We don't want to administer blood if we have that. So I'm going to listen to 6 spots on the front and the back. I'm going to have the patient lean forward or turn to the side to make sure that I can listen to the whole thing. Okay. Now that I've checked for fluid overload, I'm also going to feel for jugular vein distension. This is one of the most common signs. And I would check the lower extremities, especially the feet, for signs of edema and swelling. Check those pulses as well to make sure that the fluid's moving. Now that I've checked everything, I'm gonna go get my stuff ready to set up in the room. So I will be right back. I'm just gonna come over here and grab all of these things. So, I'm trying to make sure I'm not missing anything. If we were to administer meds, patient needed a diuretic or any type of medication before giving the blood transfusion, we'd want to ensure that we gave that 30 minutes before the blood to ensure that it has the time to do what it needs to in the body and not have any adverse reactions with the blood. So now that I'm in the room, I'm going to prepare the normal saline. So I'm going to do hand hygiene, make sure that we have that privacy still. I would also space this, check for like itchy, hives, rash, and teach those to my patient to report immediately. These are all signs of an adverse reaction in our patient during this blood transfusion. So I'm gonna put some gloves on. I'm really shaky, so please ignore that. Okay. So first I'm going to check that our line is patent. So this is our line. I'm going to just clean it really vigorously with friction for 30 seconds. For sake of time, that was 30 seconds. And I would not let it go. That's stupid. And I'm going to hook up our saline and just unclamp and flush. The line is moving great and it's not patent, so we'll clamp that back off and we'll set that down and I'll re-clean again before we start the transfusion. I'm ready now to open my tubing and set up my normal saline. I'm going to make sure that I remember every bit and piece that needs to be remembered with the transfusion. Oops. Okay. So I'm going to, I would spike a new bag for sake of practice. We aren't going to do that. I'm going to clamp off this where I'm plugging it in, remove my cap, and spike. Okay. For sake of everything, we're going to clamp this one off as well. And we'll bring this over. Stay on the bed, please. wants to fall. Okay, I'm gonna bring a garbage over just to be able to pour it into. I don't wanna have a mess today. And we're going to unclamp this and fill up to run through. Okay, this part takes forever and I don't know why. It wants to take extra long today. You know what, for sake of not losing every ounce of fluids, we're gonna clamp this part off too. Now that it is fully drained through, this is taking forever. My whole 15-minute video is me squeezing this. Bear with me. Okay, once we have ensured that this goes all the way through, which we have, I am going to clamp it off, just because we don't need it running right now. I'm going to vigorously clean for 30 seconds again to make sure that this is extremely clean. And then since this part hasn't been hooked up to anything, we can immediately hook it up. Once again, ignore my shakiness. Okay, now that that is hooked up, we can go get the blood. We just want to make sure this is hooked up, as the blood needs to be hooked up and running within 30 minutes of taking it from the blood bank. So that's always something that we want to hurry along with. So I'm going to leave the room for a minute, make sure my patient's still feeling all right. All we've done is normal saline, so they should be okay. And we are going to go to the blood bank. So over here is my blood bank, and I'm gonna have a second nurse review with me. So I'm gonna grab the blood, and on here, I'll just have you review. It says we're giving O negative, O negative. I'm afraid to turn this upside down or it'll leak out. We're gonna check the unit number, make sure the unit number and the expire date always look good. If my nurse saw anything that was concerning, I would make sure that he or she could let me know and that we would check it. It says my patient's blood type's A positive, which I confirmed that earlier with my patient, and O negative is compatible with all blood types, so I'm not concerned there. If you think everything looks good, we're gonna go administer to the patient. So upon coming back in the room, let's pray that this doesn't leak out. I'm going to do some hand hygiene again. So much, it's fine. And before I hook up my blood, I'm gonna make sure that there's no odor, cloudiness, bubbles. These are all concerning signs, and we don't want to administer that blood to our patient. Okay, I am going to put gloves on again. Now that we have the blood, we need to make sure that we administer the blood within 4 hours, or we will have problems. So we want to ensure that that has been stated and recognized before administering. I'm now going to grab my second thing. I'm going to ensure it was already clamped. And I'm going to spike my bag. Extra good. Okay, everything's clamped, so we can turn this upside down. Make sure that this is clamped off, and for the sakes of all things, we're going to make sure that that's clamped off. And then after checking everything, we can start to run the blood. We're going to run the blood at 5 milliliters an hour for the first 15 minutes. And after we have run the blood for that certain amount of time, I will come check the patient's vitals, make sure that there's no reactions or concerns, and then we will turn it up so we can administer the rest within that 4-hour mark. So let's see if this decides it wants to run. At this point, I can unclamp everything other than the saline because we want the blood to run down. Okay, everything's should be running. That looks good. So like I said, we're going to run it on a lower amount for a minute, and then at 15 minutes, the biggest thing I want to check for with vitals is those fluid sounds again. So I would listen to my 6 spots, and for the sake of time, I would listen to the back as well, checking that distension. I would also probably stop at that point and ask my patient if they're experiencing any reactions. If my patient was experiencing any adverse reactions, we would stop the transfusion, hook up all new lines, and run a normal saline through all of it. I would take the bag and put it in a red biohazard bag along with all the tubing and send it back to the blood bank for that to be checked, and I would notify my provider immediately along with reassess my patient. So after the 15 minutes, if my patient looks all good, we're going to run the transfusion at a faster rate until the time is out. And like I said, within that 4-hour mark, we'll always be watching the line, make sure everything looks good. After we're done, I would check vitals again. I would also check them within an hour of running it. At the end of it, I would check vitals, and I would come back after an hour of a stopped transfusion and recheck those vitals and those fluid signs like the lungs and the vein distension. After my thing is done, like I said, I would run the normal saline all the way through everything and make sure that it looks good and that I have a clear line before unhooking all my tubing. For the sake of a mess, I am not going to unhook it all, but I would place it all in a biohazard bag, the tubing and the bags, since they would all be clean, or all be used, I apologize, and make sure that everything looks good here. I would flush my lines and make sure that everything is still patent, and like I said, just monitor and check on my patient, and I would document, and we're good.